called OUVA. We do immersive, interactive patient experience platform that I'll be talking about in details during my talk. And then my background is in computer science, and I had my own mobile games application company for a while, worked on many game titles and mobile apps prior to joining to this company called Cinebe Interactive. The founder, Scott Cinebe, he was a designer engineer, and he created these immersive interactive experiences for museums or for public spaces, for trade shows. But it was really unique, this process, how he used immersion and motion technology and creative storytelling to create these experiences. So I thought that when I first found out about the company, I thought it was really powerful how you could be a part of the story by just standing or being in the space. So they were using motion technology, and you can use your body and gestures to interact with the experience. And I thought that that was going to be the future. That's how we're going to interact with the digital space in the future. And that was just too powerful. And no matter what the purpose was, whether to educate people or raise awareness on certain issues, or bringing people together or motivating them to be more active, the results were just amazing. The involvement and just reaction of people, and the results of whatever the intent was just so great. When I joined the company, this project came along. This was the first time we sort of got into healthcare. They asked us to create this new redesign the patient experience at this facility called Alex's Place. It's a pediatric cancer treatment center in Florida, in Miami. So we basically, put our existing experiences that we previously designed, and we put them into the lobbies, waiting areas, in exam rooms. And the goal of the project was to create this environment where kids can come in and feel welcome and feel in control and feel safe and in a stress-free kind of environment that is designed for them. So we basically it was our first healthcare project. We know coming from an entertainment and engagement background, we know we could have a big impact, but in the end, their patient satisfaction scores nearly doubled, and their workflows and for staff and the physicians were increased a lot. And they actually, rather than creating this engaging experience for them, they told us that they could actually, by just observing kids playing and interacting with these experiences, they can even assess social skills, motor skills, and this was the project, I would say, that kind of showed the potential of these experiences and what we can do with them. So after that project, we really started looking for partners in the healthcare space, and this was the project. It was a truly custom project that a multidisciplinary team of people came together. A team of engineers, designers, architects, doctors, physical therapists, physicians. Everyone came together in order to create this experience for the Nemours Children's Hospital. And we put together this concept. what we call this living garden experience, where the goal was, again, to turn the control over the patients when they come into a hospital. This is a 50-foot video wall that is being run by 5 motion cameras, and so in this experience, you can actually it goes through 4 seasons. You can interact with rain. There's interactive rain, snow. So the landscape changes all the time. But the most prominent feature is we engineered this DNA system, seed DNA system, where the seeds will be floating around, and kids can pick 2 seeds that they liked and then combine them. And by combining the seeds, they would create their own unique plants. So when it rains, they can get the water their plants and help them grow. When the sun is up, they can actually reflect sunshine, which would also help with the growth. And then from your plants, then the fruits will form, and then fruits will drop, which then the animals in this garden would come and feed from them. So this ecosystem that we put together for kids. But during the process, it was the first time we started collaborating with doctors, healthcare professionals, where they kind of helped us by designing certain gestures. It was really important that it would work for anyone with limited capabilities. Anyone, if you're on a wheelchair or if you have crutches, it was important that this experience would also be welcoming and inviting for them as well. And collaboration is also a big part of what we're trying to do. We definitely wanted to empower patients and get them involved in their own treatment, and be more social active and help each other out. And so after this project, I think we came to the conclusion where we realized the impact. We saw the impact, and we knew that by changing the quality of our environment, we can definitely have a big impact on people's, patients' mental and physical well-being. Wanted to share this. I'm actually from Turkey originally, and then I came across with this center. This is a healing center or a hospital, almost 2,000 years old, where they built these underground tunnels, and they had these openings up on the ceiling, and that's where they would put the patient beds, and so that they can get the sunlight. And also, at the time, I guess people would come by and whisper, kind of, and will start singing, or they would say motivational things to them. So I thought it was really interesting. Back in the time, back in the day, they knew that the effect on that personal touch in a care environment, that that mental factor in the healing. And this is today's care environment, which is not as cool or magical as it was 2,000 years ago. So right now we're definitely lacking the design thinking, that personal touch in a care environment. And our goal as OUVA is, what we say is that making patients and spaces an active participant of our healing journey. These are some of the numbers. We looked at the challenges and these numbers of the hospital experience, the patient experience, and we realized that it actually, in some cases, people get worse when they get admitted to a hospital. Because especially in elderly patients, you take them away from their homes, you break their routines, and we see the cases of delirium and depression, and which will make them even worse. And according to certain recent studies, we actually during our hospital visits, we spend 50% of our time just waiting for our treatment or procedure. And when we look at the factors influencing the choice of the hospital people's making, the biggest differentiator is the patient experience itself. So over a year and a half ago now, we started OUVA. We really saw the potential and started collaborating with all different hospitals around the world, and we really wanted to create this continuous experience where the Spaces platform itself would adapt to one's preference or behavior. So we really wanted to make Spaces more intelligent and involve Spaces in people's treatment. And we're doing that by not only we have done a lot of pieces where we just put interactive experiences in these solutions in lobbies or waiting areas, but now we're really focusing on how we can have sort of an end-to-end solution, a continuous experience where the experience will carry out throughout your hospital stay and even after you get discharged. So creating these cohesive kind of patient journey that is tailored for each person. And the data portion is definitely a big part of it. We know the impact, but we really want to quantify it. We want to show how big the impact is. So to actually just sum up what we're doing or what the OUVA platform is designed to do or how it works is we're using these motion sensors, or now with the wearable devices, we're collecting all this data in order to make these assessments, how patients are behaving, how they're feeling, and what we want to adapt the experience and change the experience based on how they behave, how they feel, or based on their preferences. So we're really trying to build this intelligence and so that we can make better assessments and create a better experience for people. Create a personalized experience. I think that's the most important part. And when I say experiences, I think we see them as almost an extension of the physical space. So we, trying to embed these experiences into the physical design most of the time. So we work closely with architecture firms and designers and trying to find the best content, both, visually, aesthetically as well. And the design itself, the experience design, the visual elements, the level of details. Our goal is to create this realistic experience. This is an experience actually that we recently done for Children's Hospital of Richmond, Virginia. We actually found this picture where from a James River in Richmond, and we recreated that scene in 3D in a more magical, fun way for kids. This is for children's hospitals, but it was important for us to, we want to include, all the stakeholders. There's staff working there. People come by with their families. When we create an experience, we want to also, benefit those people as well. So Um, so even though it's, we have these magical characters, we use, nature sounds and kind of, trying to create this environment for everyone, not only for kids. Yeah.
When you recreate this, is that what kind of features are you having into this? This is not only a picture. This is kind of something is moving here, right?
Yeah. Yeah. This is.
What is the
Well. Well, this was a custom project, so it was, each project is different, and based on, what client wants, what the purpose is. I mean, this was a waiting room solution that, we put together. So the features and interactions will change based on, the intent of the project. So if it's a custom project, it's usually we try to involve the client as well. But it was important for them to create this kind of familiar experience. So people actually recognize when they come in. They knew that, this was a scene from James River. They recognized the train tracks and everything. So we're trying to make it personal for them. And again, trying to use the nature elements, immersive, nature sounds that would create this, calming, relaxing environment. And now I think it's also important to, know how they're feeling, whether if they're in pain or not having a good time. So we now, with facial tracking, we're trying to assess their mood too, and that's a big factor in our design as well. So over the years, we have done these large-scale lobby pieces where the goal was to create this inviting, embracing experience. And also we use company logo. It's also good to convey the company messaging and branding and vision. So we have done kind of experiences for waiting areas where we're trying to get them engaged, involved, kind of entertain or distract while they wait, or even educate, before receiving their treatments or about the procedures that they might have. And in exam rooms, we have solutions for to use as a positive distraction or an assessment tool. And now also, with the patient rooms where people, I guess, would need the most support when they're lonely in a patient room. So in patient room, we have, a lot of different features. We can track their ambulation, their behaviors, and our goal is to kind of support them and connect them with others, and also to create this kind of engaging environment where they're in control and they can personalize the space around them. We sometimes use, even ceiling projections or monitors up on the ceiling, and we have done work in kind of these MRI rooms or CT scan rooms where they can actually, we'll give them options to change the environment with integrated lighting and again immersive sounds, because sound is also a big has a negative effect on patients, especially with these machines that really high disturbing sounds. So we're trying to also use immersive sound as a. So I really like this picture where, because it's I see kids playing, just it's such a simple interaction where you just open your hands and just rainbow of, the bigger the wider you open your arms, the bigger it gets. It just such a simple interaction feature, but makes a big difference. So, again, we're partnering with our UCSF in San Francisco. We're based in San Francisco, actually, and UCSF is our main partner. And it's really important with every technology. It's an iterative process, and it's going to take some time, to actually fine-tune it and make it actually really useful and beneficial for patients, for hospitals and also doctors and physicians. So collaboration is a key, and these are some of the hospitals that we've worked with, and again, the insights, I think, with this data, with the metrics, we're trying to kind of create these reports where we can give insights to the hospital on how they can improve their patient experience. So we collect metrics like traffic, the patient flow, the waiting times. Now we're also trying to put together a patient satisfaction score. So right now, actually, reimbursement models are changing, and hospitals and even doctors are now getting paid based on their ratings and patient satisfaction scores. So this is a big now a differentiator. It's really important for them to have a good experience, good scores, and with the intelligence, we're trying to make that happen and improve it over time. So sum up, we improve health, both physical and mental health for patients, and it results in increased patient satisfaction, and also it is we create these insights for hospitals. It's not moving along, but I guess I'm almost over. I do believe that we believe that it's really important to create this kind of involve patients in their treatment, and the way best way to do it through these technologies, so immersive technologies, and I think it's going to be we're going to start seeing more of these experiences in healthcare environments, for therapy, or for education, or to see better results in healthcare. Thank you so much.